Another area where 3D computed tomography is very helpful is with complex fractures. With X-ray you can see fractures, but you don't really know the full extent of them unless you get them in 3 dimensions and then take them apart in pieces. And then once you do this, the surgeon is going to be able to properly plan surgery when needed to put the bones back together close to their anatomical configuration in order to help reduce chances of complications and arthritis as the bone heals. I'm going to give you an example of that with a complicated fracture of the knee. Here is an X-ray of a knee. It's clear to see that the bone on the lower half of the knee is called the tibia. You can see the fracture lines in it. This is a virtual X-ray, and I'll turn it sideways. And here, looking from the side, once again, you can see that it's broken, but determining the full extent of the fracture is difficult. When you do the CAT scan, it's very clear to see, starting in the back and coming forward, that not only is this fracture very complicated, it's basically driven this entire area of the tibia down and compressed it. And this is something that you can't really appreciate on the X-ray. And the critical part about this is that these fragments, for example right here, these must be elevated or else this patient will go on to have severe arthritis. So you can do surface rendering, which shows the area of collapse and crushing of the bone. Say, for example, we'd like to look down on this crushed bone from the top. We can actually take our little outlining object here, remove the femur, and then turn and look down on the tibia from the top to look at the complexity of the fractures. Or we can spin it around and look from the back to see that the fracture actually cuts across to the other side. And if I so choose, I can remove the rest of the femur. Get that last little bit here. And once again, look down from the top of the entire femur, both sides.